According to my clock, I have 12:30. So I'll call the meeting to order, and I'll begin by reading the following statement here. This meeting of the Board of Chiropractic Examiners Continuing Education Committee is being held by teleconference in accordance with provisions of Government Code Section 11123.5. Committee members are participating virtually today from remote locations, and board staff is present at the following primary physical meeting location: Department of Consumer Affairs, El Dorado, room 1625 North Market Boulevard, Suite N220, Sacramento, California, 95834. The date is Friday, December 13th, 2024, and the time is 12:30. The board's paramount responsibility is to protect the health, welfare, and safety of the public through licensure, education, engagement, and enforcement in chiropractic care. Members of the public may address the committee during the public comment session. Public comments will also be taken on agenda items at the time the item is heard and prior to the committee taking any action on said items. Those who would like to provide public comment will be limited to 3 minutes unless, in the discretion of the committee, circumstances require a longer period. Members of the public will not be permitted to yield their allotted time to other members of the public to make comments. Individuals may appear before the committee to discuss items not on today's agenda. However, the committee may not discuss or take action on these items except to decide whether to place the matter on the agenda of a future meeting. Please be aware that this meeting is being recorded. Please turn off or silence your cell phones. We will now take the roll. Dr. Daniels, will you please take the roll of the committee today?
Dr. Lawrence Adams,
Present.
Dr. Pamela Daniels, present. Mr. Raphael Sweet.
I am present.
We have a quorum.
Thank you, Dr. Daniels. Welcome, members of the committee and the DCA and other public members that may be joining us today. Agenda item number 2 is public comment for items not on the agenda. Members of the public, you may address the committee at this time. If you choose to identify yourself, that's voluntary, and your name will be recorded in the official minutes. If it's not provided, that's fine as well. So, moderator, if you would open it up for public comment for items not on the agenda, I would appreciate that.
We are taking public comment via WebEx for items not on the agenda. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand. And for our mobile device users, you may need to hit the ellipses button, that's the ... and cycle through one of 3 different pages in order to find your hand. People will be given 3 minutes to speak, and I'll give you a 15-second warning before your time expires. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
I do. Thank you, Dave. Appreciate it. Okay, we will progress to item number 3 on the agenda, review and possible approval of December 1st, 2023 committee meeting minutes. Open discussion for the committee about anything on the minutes, or I'll entertain a motion.
I make a motion to approve the December 2023 committee meeting minutes.
I'll second.
Thank you. Moderator, if you could open it up for public comment on agenda item number 3.
We are now taking public comment on agenda 3, the approval of the December meeting minutes and the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. For our mobile device users, that means hitting the ellipses button, the ... if you are cycling through the 3 different pages in order to find your hand. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the motion?
Yes, thank you. Appreciate that. Dr. Daniels, would you take the roll call for the motion before us?
Dr. Lawrence Adams,
Yes.
Dr. Pamela Daniels, yes. Mr. Raphael Sweet,
Yes.
Thank you.
motion passes.
Thank you. Looking at agenda item 4, update on board's continuing education program, and we'll give the time to our executive officer, Kristen Walker.
Thank you. I just have a few items to highlight as part of my update today. I'm going to begin with business modernization efforts. So where we're at, since the committee last met, we've basically developed and implemented a new paperless CE course approval workflow within the office. So we've made a lot of kind of improvements to how we're handling our CE course applications and trying to really increase efficiency within the office. So we've developed that paperless workflow. And we've really identified just a few more internal areas where we can probably achieve a few more efficiencies in that process. So we're looking to implement that even further in the coming months. But it was really kind of an exciting project for us because we had been, CE was our remaining kind of work area where it was just heavily paper-based process, and we were able to stand up an electronic workflow. And that's also going to really help us and assist us when we're getting to the implementation portion of CE functionality in our Connect system. That functionality had kind of remained on hold as we were working on trying to upgrade to a new version of the Connect system. But then, unfortunately, just due to limited vendor resources, that system upgrade has been temporarily paused. So now we're looking to develop the CE functionality in the current version of our system. And really having that paperless CE workflow outside of a Connect process has really helped us kind of identify ways that we can, not only implement it, but implement it in, as minimal cost as needed for that implementation. I also had a very good discussion with DCA's Chief Information Officer about some potential solutions to replace the current CE course PDFs that are on our website with a more interactive course listing where licensees, other members of the public, even our own staff would have the ability to go in and search and filter our approved CE courses by various parameters such as the provider, the course date, your subject or competency area, and things to that effect, even the location. So had a really good discussion there. There's a few different pathways that we can explore. One of which we were originally intending to use would have been the Connect system, but he's got some thoughts that there's potentially a pathway that DCA could develop something directly for us as well. So really looking forward to having those discussions in the coming months and being able to report back to the committee with something to replace that antiquated PDF course search functionality that we currently have on our website. We're also looking to save costs on our Connect project by forward thinking and designing that workflow to the new regulations so that we can leverage things like easy to update lists of course competency and subject areas so that we're not duplicating our efforts by trying to build something now with existing requirements and then turning around in a few months to then try to build to new business requirements. So we're building primarily to the new requirements with enough leverage and flexibility that we can implement either at the time of the implementation of the new CE requirements, or if we're a little bit ahead, we can at least get something live and stood up for the CE providers. I've also got within the meeting materials, I've got some of our CE course application statistics in there. You can see it's in line with what we've been expecting for the implementation of the updated fee amounts for our CE courses and then just the resulting effect there. When we're looking at our statistics, we see a decrease from about 1,900 applications totaling about 9,000 hours down to a little over 1,100 and hovering around 4,000 hours. Looking at those numbers and our projections, we're thinking that 1,100, 4,000 hours figure is probably going to be kind of the new reality for our CE program because we're accounting, when we're looking at those numbers, of course, we're seeing the decrease due to the increased CE course application fee, but even with the implementation of the new regulations and looking at a 3-year approval cycle, we're likely going to see similar annual numbers given the fact that we're eliminating a workload of having to do that annual renewal. And then in exchange, we're expecting to see an increase in the total number of courses that are being applied on every year. So that's, as we look further out, that's a more realistic long-term number for us to be looking at for our continuing education program. And it's actually, it's much more feasible at the staff level to be able to maintain that level of service. When we were kind of in that position of getting the 2,000 course applications every year, 10,000 different hours of education, and then reapproving it each and every year, it was a pretty significant staff workload. So like I said, with getting, with shifting to that 3-year approval cycle and then maintaining basically a same bank of about, 2,000 to 3,000 courses just leveraged over 3 years, it's more sustainable for staff. It's also more sustainable for providers. Also just briefly wanted to share that we are going to be ramping up our CE audits for our licensees at the beginning of the year. We're going to provide some advanced notification to providers and the associations. We're going to share a message via our listserv. We're not trying to catch any licensees off guard, but we do need to increase the number of CE audits that we're performing. And we want to make sure that licensees are notified in advance. They can dust off those records and get them ready so that they can submit if they happen to get that audit notification in the mail. Really the goal around all of that is just purely ensuring compliance. We did in prior audits, we've really kind of fine-tuned that process. We know that by starting and ramping up these audits, it's going to have a resulting workload impact to our CE and our enforcement units, but we're at a kind of a good point where we can absorb some of that, particularly on the enforcement side. So we're going to go ahead and start working on those. And then also within the packet regulations, so our comprehensive updates to the CE requirements, provider course approval process, that remains our top priority as we're heading into our new year. We're really expecting to get that over to OAL in the coming months. We've got 2 more proposals there that are on today's agenda around basic life support, and then the discussion around creating an extension process for CE hardships. And then the last item that's listed there under our regulations, it's been in the backlog for a very long time. The idea of exploring a new appeal process for denied CE provider applications and course applications. Staff will work with committee chair Dr. Adams on really what's the next steps for that proposal. Are we going to entertain that, or basically what's next for that? And then with that being said, I'll be providing the update at each and every committee meeting that we're going to be having this month into next. But we're right about a year out right now from our next sunset review report and about 15 months out from our hearing for the legislature. We're also in a good position for, with each of the committees, they've all done significant work in looking at the pending regulatory workload, having those policy discussions and determining the path forward. So we're at a position to where for the committee members to start looking at, well, what's next? Because we're going to need to start working and planning on that as we're going into sunset and then to the next strategic plan following the sunset hearing. That's what the legislature is going to want to hear from us. We've done a lot of work on the policy side of moving kind of a lot of inherited work forward, but now with our board members, it's what's your interest, or what's your policy objectives that you'd like to see accomplished over the next 1 to 3 years, so we can start working those through the committee levels. So we'll be having those types of discussions with each of the chairs going into the new year, and then also posing those questions to the members to really start brainstorming what's next, and particularly with our CE committee and our enforcement committee. So with that, just happy to answer any questions from the committee.
I just have a couple questions real quick. On the Connect system with the audits, are you getting enough participation in the Connect system that you feel like you can do those audits via the Connect system, or are you still having to have people produce their documents?
We don't have enough records in the Connect system yet to be able to just create, just to do the audits in the background. But when we do those notifications, we want to make it as easy as possible for the licensees. So unlike in years past where you would get a notification that says you need to mail in all of your paper or fax it to us, and then we create a big paper workload, we're going to give licensees flexibility. We're going to send them the audit notification and give them the option that they can either upload it into the Connect system, or they could do it the old-fashioned way, mail it or fax it to us. So that way we can ideally encourage them to utilize that tool, but give them a pathway. So yeah, we can't audit just purely off the Connect system yet.
Is what kind of compliance do we have, or participation do we have from our licensees in the Connect system? Is it about 30%, or is it climbing?
It's climbing. So we, as of when we had last checked, we're now a little bit over 40%. So we've increased from 30. We also updated our renewal notices just recently. I believe it was beginning in November to really plug the Connect system. So the prior notification didn't make reference to renewing online. The new messaging that's going out to licensees tells them not only is Connect available to you, but it's also the preferred method of renewal, just given the 1 to 2 business day processing time. So we're expecting that to increase into the new year as more licensees are seeing that notification and going into the system.
And then about how many out of that 40% are uploading CE documents?
I don't have that data point today, but that's a good one for me to research and definitely report back to the committee.
Is it easy for them to do? Like, is it they take a picture of it and they can just upload it type? Is it getting to be where it's pretty easy that way?
Correct. Yeah, they can fill out the course details. So they type in just the basic details of the course date and the subject area, and then they upload a copy of the corresponding certificate as evidence. As we get deeper into the Connect project, the long-term goal is direct integration with the providers so that the licensees aren't the ones providing the certificates. The providers just give us the data and we integrate it with their Connect record. We're probably I'd say about 18 months to 2 years out from seeing that finalized.
Yeah. And then my final question is we aren't holding off on getting our comprehensive package that we passed a couple of years ago on BLS and other stuff, are we?
No, absolutely not. We're not holding off on it. It's just, the comprehensive package has a lot of data and background information that had to be gathered. We've sifted through and got all that information, but it's our largest package that we'll probably do this decade, to be honest. The ones that follow behind it that are significant as well is disciplinary guidelines and our chiropractic college regulations. But those two are very small in comparison to the CE package. So we're in no way holding off on it. It's just we're doing our due diligence so we can get this through OAL and not have any hiccups.
Okay. All right. Thank you. Any other? I see a hand, Dr. Daniels. You need to unmute.
Yeah, 2 questions. One to follow up with Dr. Adams. Can you, for the public, describe a little bit more of what's holding up the big package as far as so people can kind of understand? And because I know there's a, issue as far as defining, live stream and live, and it's, as I mentioned in the October board meeting, you were here for the stakeholders. At the same time, if our licensees are not compliant and doing well, it's just a whole trickle down. So is there anything that you can share, within reason as far as kind of where we're at? And I know, it mentions that, you're anticipating it for the beginning of the year. So that's my first question.
Sure. So it's the similar challenge that we've had with just about every regulation that we've been trying to move forward for BCE, not only continuing education, but we see it on the enforcement side too, where we had ideas and discussions that had occurred over a course of, you're talking sometime in the case of CE over a decade. So there was a lot of different pathways the board had explored at the prior board, it's not the current sitting board, but had explored different pathways of how they were going to address the CE requirements. Then we've settled on the comprehensive updates of what we're going to do now, but you've got to document all the justification for each and every change and reason behind why we're doing it with data. We're going to see a little bit of this when we get into the discussion on the next item on BLS, when we talk about justification. But so we've got the justification there. It's just a lot of staff work to gather up all the information, compile it, put it into documentation so that we can get it out there and to the OAL. We're hoping that once we get it over that major hurdle, it's going to be relatively straightforward because we're not seeing people come forward, aside from timelines, which we fully understand. We are doing the best that we can, and we're not dismissing those in any means. But the good news is, for these regulations that the board had considered and passed, the only feedback that we're getting is around timelines. So when we do get to that open public comment period, we're expecting that we're not going to get any new surprises. Somebody's not going to come up with a public comment that's going to have the board potentially change direction and have to, not start all over, but basically amend text and start going down a different path. So if we're keeping that clean direction, we're just aligning ourselves so that we can get this through. So that's, it's just all that background. And we've had the discussion at the Government Public Affairs Committee meeting, and I believe we've had it at the board, probably could have it again at the board, around best practices for developing regulations in the future is to gather all of that documentation and all of that justification as you're moving it so that everything can move together. The problem with it was just those records weren't organized in a way along that 10-year period. So we're now trying to go back and do it in present time.
Okay. Yeah. I mean, I had mentioned it. I'm glad to hear you say that because I had mentioned it before as far as I think the board members, we need to understand, the deeper process. And when we're having these conversations, and one of the biggest ones that, I took away of when we talked is the justification, which, I have notes for BLS. So, you being the executive officer, when we're having these meetings, if you can help remind these conversations and us as far as so that we can move things along without having these conversations, without having the knowledge or, the backup material. So that would be great. And then just my last question was, what are the obstacles to people using Connect besides knowing about it? I mean, are there other obstacles of why people are not why we're at 30-40%?
I think part of it is just a matter of habit and getting the word out more to actually use the system. So there's other boards that have much higher adoption rates, but those rates are due to force, if you will, for a lack of a better way of describing it. We have boards that they don't send you a renewal packet that you can fill out in the mail and send back with a check. They send you a postcard that says you need to renew and go online. So of course they're going to have a near 100% compliance rate because the only people that aren't renewing online are the ones that dug up the PDF form on the website and mailed in a check. We're still sending a full package with the payment coupon at the bottom. So we're seeing a lot of potentially not even the doctors, but their staff just receiving it. Their accounting office just starts filling it out, gets the doctor's signature on the form, and they're still sending it in. So that's, we're trying to encourage more use of the system. We haven't yet explored trying to, replace that renewal packet with just a postcard. That could be more of a long-term discussion on the licensing committee if there's interest in moving towards that direction. But I think that's, in addition to not using the system, I think still the convenience of providing that package and just the habit of doing that every year. It's trying to break that with the licensees and have them go online.
I mean, is it something that we should consider as far as just, budget wise sending it out and encouraging, should we be talking more actively about transitioning away from that, or is that not appropriate?
I think we should. I think that's one area where so we want to do a lot of work with DCA's Office of Public Affairs to kind of help with some of our messaging around certain campaigns, and one of them is around Connect. We'd like to have them kind of help us with a little bit of the look and feel of the system, and particularly accessing it and some of the messaging around that. And if we can kind of introduce that and start seeing, not at 40%, but if we start getting maybe 60 to 70% licensee compliance, then we start phasing in potentially replacing that renewal form with a postcard instead, and then kind of we can get the rest through. Because I think you can get there. I don't think we're quite close enough yet to pull the plug on the paper renewal forms.
It makes me think about the whole real ID thing, that is required now. I mean, it kind of the same thing, like, maybe we can use our providers as a way, to start telling the providers that when you're teaching continuing education, have a public service announcement that says, start gravitating to the Connect system, and remind them and say that this is, that we say you've got, maybe we set a time, says, by June of 2026, we're going to Connect. So you've got, 18 months to switch over, kind of like the real ID.
Yeah, I think
I think if we, yeah.
I think that's an excellent suggestion and probably a a good implementation plan, because yeah, you could phase it in over time. And the Real ID, they really got the messaging out. I know they kept shifting the timeline, but that was making people aware that, hey, this is coming. You're either going to have to, jump on now, but at a certain point, you're going to get cut off. So that's another concept we could explore as well.
Well, I think if we use our website, we're going to get the people that are going to go to the website. If we also use providers saying, hey, please do a public service announcement. And then, we also, when we're interacting with other licensees, as we do some of our engagement stuff, I'm going to be at Life West in February speaking to the students there. So I can obviously bring it up and start talking about, moving people. So I think if we do more of that, we can probably get a bigger adoption. It's not going to take us that long where people are just going to do it. And the easier we make it, the better. But maybe we ought to consider, a hard stop, of 18 to 24 months that, migrate over and start utilizing the system. I think from auditing standpoint, from communication standpoint, if people are using the Connect system, they're going to be updating their emails and their phone numbers and stuff like that more often because they're having to renew every year. And I think we'll get more ability to interact with licensees, and have updated information on them as well, which would be beneficial for more of the engagement side that we want to do as a board as well. So maybe make a note of that on the next agenda item or next meeting. We can come up with maybe some more succinct parameters about how we can get people to migrate to the Connect system, because I think it can be beneficial for the board, staff, and also for communication with our stakeholders and licensees.
Yep, that sounds excellent. Thank you,
Mr. Sweet.
I think most of my questions were answered. I did have a follow-up question on the audits. Do we have any metrics around? I know you said they're going to be going up. About what that increase looks like. Are we talking about a 10% increase in audits? Or are we talking about a 100% increase? And what that workload is like? How big of a burden is that to take on?
Well, so the way we're going to approach the audit is typically we were doing annual audits where we're looking at one renewal period at a time. Instead, we're looking at a sample size of about 5% of our renewals, but we're going to do the full 4-year period, but then having to integrate the data to basically filter out certain years where somebody, say, was inactive or not licensed, but basically doing a 4-year look back so that we're doing a more effective audit, because in the past we were doing still a similar high volume. At one point, the board was doing 10% audits, which just was not sustainable. So we want to drop down to 5. That's still a little bit higher than what other boards tend to do. They're usually in around the 3%, but 5, since it's been identified as a prior sunset issue, it seems like a fair number that we can take on. But by doing the 4-year look back, we can get a lot more information done, but with a little bit more efficiency in the staff time, because comparing 1 year versus 4, it's just a little bit more efficient doing it that way.
And then the same for the increase in the enforcement or potential enforcement issues.
Correct. Yeah. And we've, when we did the last kind of major ramp up on the CE audits, which was just before the pandemic, we had basically redesigned all the enforcement procedures around how to handle those audits. So we've got good foundation in place now for when it gets into the enforcement unit for them to handle those audits appropriately. So there's not as much of an impact that we're going to see on the enforcement side. It's going to be a little bit more on the licensing and continuing education staff to actually conduct those audits.
Okay. All right. Thank you.
Thank you. Dr. Daniels, your hand's up.
Yeah, so once, and just from your past experience, once you find the deficiencies in CE from the audits, what does that look like staff-wise, time-wise, currently? And then are there things that we can do to make that more efficient?
So we addressed a lot of the efficiencies during that last major cycle, but we're basically, once somebody fails an audit, they're given a notification that, you were found to be deficient in these areas. We give them an opportunity if they failed to submit something, like maybe they took multiple courses and thought they met it, but they've got more information to provide us. Or if you have context, you have a statement you'd like to give us, we give them a reasonable deadline to basically show us anything else you have, basically respond to that failed audit. And then from there, just depending on the degree of deficiency, we'll go anywhere from doing an educational letter to a letter of admonishment to a citation. When we did this the last time, that's when we started to see a significant increase in the number of citations that were being issued, but it was, as far as the amount of staff time that goes into that, it's relatively small because they're basically templates of issuing citations and just putting, the details of a specific audit in there.
And then once those citations goes out, how long does the licensee have to correct it? And is that followed back up?
So yes, so after a citation is issued, a licensee has 30 days to pay the fine and comply with the order of abatement, unless for some reason we specify a longer time frame in that citation. So it's generally a 30-day period for them to comply. Sometimes if they were deficient and didn't complete like an entire cycle of CE courses, we might give them 60 to 90 days to comply, but it's a relatively short time frame. Sometimes if they're requesting informal conferences before me, we try to schedule those within 30 days. So then our time frame looking at those citations starts being around 60 to 90 days. And occasionally they can request a formal hearing, but in these ones, we've already confirmed they don't have the documentation to provide. So we're not seeing licensees contest these to formal hearings.
Okay, thank you.
Okay, thank you, Ms. Walker, for that update. Moderator, if you would open it up for public comment on the EO's comments and update.
We are open for public comment via WebEx on agenda item 4. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3. And as a reminder to our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the motion?
Well, there's no motion to
Not
this,
the motion. My bad.
but the agenda, yes. Yes. Okay, that was informational only, so we'll move on to agenda item number 5. Thank you, moderator, for that. We'll turn the time to Ms. Walker again to discuss agenda item 5, where we're going to be discussing the BLS update.
Sure. Thank you, Dr. Adams. So just briefly, by way of background, the board from 2003 to 2007 used to mandate CPR certification for all licensees as a condition of licensure. In 2007, the board had repealed that regulation. Then beginning in 2015, the board's licensing, continuing education, and public relations committee had started engaging in discussions of re-implementing that CPR requirement for public safety reasons. That BLS or that CPR proposal was then kind of put on hold as the board continued their motions towards working through the more comprehensive continuing education regulations. Fast forward a bit to after the Continuing Education Committee had finalized the comprehensive CE proposal, staff brought the CPR certification regulation back before the Continuing Education Committee for some discussion and consideration. Staff recommendations at the time were potentially replacing that CPR certification requirement with a basic life support certification requirement, because doctors of chiropractic are healthcare providers. So having them complete the level of education as a healthcare provider was just more in line with the expectations of the public and just the level of training that's appropriate for doctors. The committee discussed that proposal and had come up with additional pieces to it, more so around being able to basically create, right now there's no requirement, so having to be mindful of the fact that there's certain licensees that are in practice that either cannot or not comfortable performing CPR, what other options were available for them to be able to still comply with the regulation and not be essentially put out of practice. So there was the discussion there around mandating either the BLS provider certification or an advisor level certification, where it's a similar education, but the live component of the testing is rather than physically performing CPR, you have to demonstrate that you can instruct someone else in all of the steps to perform CPR. The committee also discussed the idea around having, if somebody has that advisor card and they're not, they're either unwilling or unable to perform CPR in their office, providing some sort of public notification whereby they post something on their door or in the main area of their office, basically letting patients know that. So that's where we left off when the committee last discussed this last year. Kind of over the course of the year, staff, we were really kind of tasked with putting something together on this proposal and bringing it back for the committee. We were trying to kind of come up with some data and some documentation around how to justify this requirement and be able to put it into regulatory language. And where we kind of stand right now, unless the committee can provide us with some additional information, is we see potentially two pathways forward on this. The challenge that we're going to have when it comes to this regulation is around the addition of the requirement for the advisor certification and the patient notification requirement. And the reason I say that is we're having trouble finding data to justify the necessity of that additional layer of the requirement. Our justification as it stands right now for the basic life support certification, whether it be provider or advisor, is the public safety protections that are enhanced by making sure that licensees have that education and training. But unlike the other health professions that either have it through an employer mandate or specifically through like a board mandate, such as like dentists, those other health professions have those requirements because unfortunately the care that they're providing potentially runs the risk of either a cardiac or breathing emergency. Fortunately for chiropractors, we don't have any evidence that we can find or locate as far as a causal relationship between chiropractic care and then some sort of cardiac or breathing emergency as a direct result. So when we're looking at necessity for this training and education, it's based on the fact that whether you're caring for elderly patients or you're caring for a patient population with chronic pain conditions, they're more likely than, say, maybe the general population to experience some sort of cardiac or breathing event in the chiropractor's office, but it's not the direct result of any type of treatment that the chiropractor is performing. So with that being said, that's where we're struggling with the justification around providing the patient notification, because the education and training portion is great public policy as far as making sure that they're more aware and willing and able to assist if they want. But it comes down to just a good Samaritan kind of protection if the licensee is going to jump in and perform some sort of CPR procedure if something was to happen in the office. So without that causal relationship, that's where we're struggling a bit on the justification for that final piece of patient notification. So we want to entertain a little bit further of a committee discussion on this proposal and the different aspects of it. What we've got as far as text in some concept text in the materials is around the education and training component. We took out from when the committee last looked at the language, the live skills assessment had reference to like a live hands-on skills assessment. We intentionally took out the term hands-on so that it's inclusive for the advisor certification, where it's still a skills assessment, it's just verbal skills versus physical. This covers the education component, but like I said, we're gonna need either additional data or justification to get a little bit further beyond that. As far as options for moving forward, the committee can basically consider three different things unless we have further justification to go down the patient notification path. Option number one is similar to what we have here in the meeting materials, where you're implementing an ongoing requirement that if you want an active license, you have to maintain current certification in either the BLS provider or advisor certification. So that means ongoing. We would address it just as we do with our continuing education requirements. We can audit, and you'd have to be able to produce, proof that you've maintained that continuous certification. If there's a break during a certain renewal period, you're giving us two cards. You're showing us when it expired and then when you renewed it. The other option, some boards implement, rather than having it be an ongoing requirement, if it was a one-time educational requirement, you could approach it similar to how the board implemented fingerprinting requirements, where, as of a specific date, all new licensees have to produce it at the time of licensure. and then you set a deadline for a certain renewal period that all existing licensees would have to provide proof, and you wouldn't check ongoing. That's another option. And a third option is if the board even wants to move forward with this proposal or not. So those are the three that we have as of now. We would need a lot more justification, I would say, from the committee for us to be able to get where we need to be as far as a patient notification aspect to this proposal. So with that, I'd like to just turn it back over to have a discussion on the topic, so we can kind of make some decisions on this one.
Okay, thank you. Very thorough, very informative. Comments from the board or from the committee or anybody else, I guess, that wants to comment. Dr.
Kristen, did I hear you correctly that you need more justification for the advisor or just justification for the notification to patients?
Justification if we want the notification to patients for the advisor. If we wanted to just implement a requirement to maintain the certification, whether it be provider or advisor, we're all set with justification on the public safety aspects and benefits to implementing that requirement. It's if we go one step further and require that those with an advisor card provide some sort of patient notification, that's where we need the additional justification.
Okay. I didn't have, because we just got this a couple days ago, I didn't have time to do as much as I wanted, but I did do a little bit of digging, so I can offer just some questions and maybe some other things to consider about kind of the conversation. So most hospitals require, mandatory training of CPR, BLS. Most medical schools do as well. When you start reading some of the literature, it's been a little bit of a conversation that shockingly, nurses and medical doctors and students are really not providing good CPR. And so what they're finding is that the students and or the physicians aren't being compliant with the classes that they're supposed to be taking. So we have, even in, say, we take medical and nursing, people aren't necessarily being compliant with taking the class and keeping their skills up. Then you look at some other literature and it is something, so I wouldn't go for a one-time requirement because it is something that is supported in the literature that you actually do have to practice. And so when they, and these are fairly recent papers, that when they test people, the compressions really are only effective in saving somebody if they're done accurately. And the only way that you can do that accurately is you really need to practice it, just like we need to practice adjusting. So it's not something that you maintain your skill set over. If it's just calling 911, that somebody can remember. But if we're, to me, if we're going to require it, it needs to be practiced, and it needs to be practiced. Minimum was every 2 years. Every year on some of the studies was better. I think every 2 years is acceptable, but it is a skill that you need to practice. So if we're doing it to save people, to be compliant with that, it is something, like I said, needs to be practiced. As far as, there isn't necessarily a causal relationship, as you were saying, as far as breathing problems and out of hospital cardiac arrest, which is OHCA. But I don't know if this is enough of a justification. People can talk about it a little bit more, but the public has a presumption when they walk into a doctor's office, whether a medical office, whether it's a PT, an MD, a chiro, or whatever. And it's just my office, but I was just curious. So I asked all my patients, do you assume that I know CPR? And I mean, you should have seen their faces. They were like, well, yeah. Like, I mean, they were adamant that I knew it. And then when I shared with them, that they studied emergency room departments and the medical people there, that they did not perform good CPR, and they were shocked. They were like, what do you mean? And what do you mean they're not all certified? So there is, I think, a public perception, and I didn't do a literature dig on that, that when you're coming into somebody's office that is medically oriented, that they have a particular skill set. So there is a presumption on the public, onto the physician, that they do or should be able to know it, perform it, or to do it. Some of the other questions that I think of is like, why are we requiring it? Like, what is our justification? I know the previous board took it away, said it didn't change outcomes, but my question is, what outcomes were you measuring? I don't think there was a study done. I don't think there's any numbers on what outcomes. So it's, you know, that comment of, oh, it didn't change outcomes. Well, you don't know because you didn't study it, you didn't look at it. But it brings up the question, what is our justification? Like, what is our goal? What is our outcome? And for me, you know, yes, it's great to look at other professions. What are medical people doing? What are nurses doing? It is sort of the standard of care that everyone sort of has that baseline. But, you know, what do we want for our profession? If the medical people aren't doing it, or nurses or whatever, but do we want to do it? And there was some conversation as the reason behind doing it is that it raises awareness of the responsibility to help others. And it goes in line with sort of, you know, the more training you have, the more subconscious education and thought you have to another person. So one of the justifications that is a little intangible is knowing how to do that. They do have some literature supporting that it increases the awareness of the responsibility for others, and that is what we do, and that is what people coming to us expect, is that we are caring for them and we are responsible. You know, we have them in good hands, so to speak. It also raises awareness through the community, and there was one great paper. It really talked about everyone being involved in CPR. The World Health Organization was supporting, there's a European Resuscitation Council to promote education on resuscitation, and they're teaching 12-year-olds to do this. And so if a 12-year-old can do the training and is expected to be able to do this, I think our licensees are, you know, should be as well. So there's a community outreach of teaching 12-year-olds and up, school-age children, how to do CPR, and their training was 2 hours a year. So those are kind of some of my notes on it. I don't know if that's helpful at all to the rest of the board members, but that's what I have.
And I just want to clarify, just to make sure that I'm understanding. So you're saying we have justification as just as a basic public policy to mandate the basic life support certification. The justification is more difficult in terms of notifying patients regarding the advisor. Do I have that right?
Correct. Yeah. Where this proposal left off at the last discussion was mandating, so as a condition of licensure and active status, maintaining a basic life support, either provider or advisor level certification for all licensees. And then those that had the advisor certification, which is designed for people that are unable to physically perform CPR. So if somebody has that advisor certificate, then they would be subject to a public disclosure notification, so that patients are aware that, you know, this provider has the education but physically will not perform CPR if an issue was to arise. Where the challenge in that justification is with the other professions, and where they've had justification for why you have BLS, it's not optional. So it's because it's directly correlated with the care that they provided. If something goes wrong, like if they've sedated a patient and they have an emergency, it's their duty to jump in and perform CPR. So they don't have that advisor option. With our licensees, we don't have that same data. They're not performing the types of techniques and procedures that would potentially, you know, put the patient at that type of risk. So the public protection benefit is just along with what Dr. Daniels was saying. It's, you know, the public's perception that doctors have this knowledge that they would help if something was to go wrong in that office, but there's not that direct relationship like we see in the other professions. So the challenge lies in that justification for the patient notification requirement, because if we have to make that patient notification requirement, then it kind of starts getting down the path of, well, then why are they even able to practice if they can't really excuse themselves from an obligation to jump in? But that's where it's kind of, we're having difficulty in that area.
Thank you for clarifying that. Yeah.
Thank you. I guess, you know, I kind of concur with Dr. Daniels, and I think also with Mr. Sweet that if we're going to have this, I mean, I don't think having it be a one-time thing is really makes any sense. You know, I've had it multiple times, and I'm going to need a refresher and a skill update. So, and I think there is strong justification for it to be something that is part of licensure. I think it's best practice. I think, as Dr. Daniels pointed out, there's an expectation that our patients just kind of think, oh, of course you have this skill. If I was to have a heart attack or something like that on the table, not necessarily directly related to the treatment we provide, but if something happened in our office that we could provide the basic life saving for someone until EMTs or other professionals were able to come. So my feeling is, I've read over this. I really like what it says. I would entertain a motion that I think would make sense for us to go forward with implementing this. I like the way it's written. I think we're ready to move forward and do that. And my feelings would be that we make it a requirement. My one question I did have about number 4 on subsection B, Ms. Walker, where it says successful completion of written examination and life skills assessment. Most of the CPR classes that I took when we were required to do it, and what I've taken before, was there was not a written part. It was assessment of the life skills by somebody there that then signed a certification that we completed it. It was like 2.5 hours. And then we completed it, and they signed off on us after they looked at our skills. There wasn't, as I recall, a written exam. So that would be my one caveat, is that I think that adds another layer of difficulty to our licensees from a standpoint of making it be a written and a life skills assessment, because now you're talking about somebody having to proctor a test and all the other stuff that goes with that. So I would be more inclined to say that most of the standard CPR and basic life saving that I've done were done with a life skill assessment, that I performed it in front of the person. We did a rotation, and we all watched other people do it. And then we got evaluated by the lecturer or teacher. And then we were signed off on it, given the certificate that was good for 2 years. So that's my experience in the past, and that would be my only suggestion, would be to change that one aspect of it. Dr. Daniels, your hand's up.
You're still muted.
All the ones that I've done through the American Heart Association that are certified through them, there's always a written test. And so it brings up a question, because I know there's a lot of people that give CPR classes, and I don't know what their training is and who they're certified through. And so the beginning of the language, as far as approved by American Safety and Health Institute, I think we need to clarify, due to Dr. Adams' point, like, I think we need to clarify that, because I do it every year, and there's always a written. You do your skills, and then you have your written, and then they sign you off, and then you're free to go, and they give you, they send you your card. So I've never done one that didn't have a written test. So I think we need to clarify what is taught and what's accepted by the American Safety and Health Institute, if we're using them as the certification body that we are in alignment with. I think we need to clarify that. Because like I said, everyone I've done always has a written, and Dr. Adams hasn't had a written. So I think we need to figure that out.
Well, to be fair, I don't want to hold the process up. I have no problem with doing a written.
But I think we
If
should
that-
know. Like, I mean,
Oh, no, I'm just saying that, I guess what I'm saying is that when it says written examination and life skills, that means that this policy will require both. And so I was just saying that, successful completion of a life skills assessment, that was my only point, was that if there's a written component, great, you got the written and the life skills assessment. But I just remember that we had firemen from our local fire station come in that were, CPR instructors for the American Heart Association, and they just assessed our life skills. And maybe I'm not remembering it. It's been, almost 20 years. Maybe there was a written component, and I just don't remember it. I just don't recall that. I just remember having my skills assessed and having to, work on a mannequin. They'd bring in like 8 mannequins. There was like 20 of us, and we just, did our, different stuff, head tilt, mouth sweep if we were doing, I'm talking about all the stuff that we did for choking and all the other stuff, clear the airway. And then, I know things have changed though in the last 20 years. They don't do the mouth breathing like they used to. They don't do all that stuff. So there's things that have been changed that are going to be updated. I just was putting that in there so that we didn't end up making it more laborious or more, but it could just be that that's the way it's going to be. So I don't want that to hold up. I really would like us to get this voted on, implemented. I don't need any more discussion on it. And if the consensus is a written component, I'm fine with that.
I mean, I hear what you're saying. I'm just saying, I think, Ms. Walker, correct me if I'm wrong. I mean, as far as legal and OAL, I think we need to clarify to make sure that, I mean, do we know what, the American Safety and Health Institute actually requires, and does our language match that as far as what Dr. Adams was talking about, the written and live? I mean, are we comfortable with that legally?
I believe it reflects the current requirements. We will ensure that it does. So with the text that we have in the packet is a concept, we will do the final touches on it before it goes forward to the board. And I will just comment on, as far as the written exam, it doesn't mean like a proctored formal written exam, the intent there, and there's probably, again, some opportunity for further clarification, but the intention there is the skills check. So the most common model that we're seeing nowadays is you sign up for your BLS certification, you have to take an on-demand online course, and you're sitting there getting the educational component, and they have skills assessments as you're going along. So it's not merely just logging in and letting it run for 2 hours, but you actually are having them checking your skills as you go. After you complete that portion of it, then you schedule an appointment, you go down in person and perform your skills assessment, or now they have those I think it's the heart code BLS, but they actually have a machine. So it's not even a person, it's a machine that's measuring your competency to perform that. So the intention was to be very broad and inclusive. I can see where there's probably a little bit of room for further clarification around that language, but it's just not purely just the educational component, but it's similar to our CE, where you have the learning with the knowledge check as you go, was the intention behind that written exam.
Yeah. Okay.
And then is
I'm
this
satisfied.
is this in conflict at all, as far as, I mean, we're going to talk about it with the natural disaster, with which we can talk about there, but the natural disaster, temporary or permanent medical condition or disability. Anyways, we can talk about it when we get to that section. I just didn't know if the language here, when I was reading both of them together, I was concerned that we had a conflict, as far as, because we don't have, you were saying in the literature, we don't have the authority to do exemptions, yet later we talk about exemptions for permanent or temporary disabilities.
We're moving beyond. So we're not doing exemptions, we're looking at extensions of time. So we could, and we're gonna have to work that out between both of the proposals, especially if we're going forward at the same time. The idea of there's a requirement that you maintain this continuous certification, but what happens if you're just about to have your certification expire? It's right around your same license expiration date and some sort of disaster happens and you have to apply for an extension. The intent is to be able to give them a reasonable amount of time to get themselves back on track. There's a scenario there where a licensee potentially is going to have a gap in that certification. But in an ideal world, you're managing it and you're not waiting until the expiration date of that 2-year period. You're getting yourself recertified a month or two at least ahead so that you're overlapping. But that's definitely part of that discussion around extension. I think it does need to include CE, but then also BLS if we're moving forward with this proposal.
Okay, and I just want to be clear, this is every 2 years that
Correct.
Okay. Mr. Sweet?
I think I'm good. I was going to ask, since this isn't my realm, how long does a certification typically take? I know you were saying, if there's a written component, it probably takes a little bit longer. How much of a time are we asking our licensees to spend on this?
For the class?
Yeah, my recollection was it was about 2 to 2.5 hours.
Yeah.
And
Okay.
the recent one, probably I would say 4. So it's what Ms. Walker was saying, like the last BLS I did, which just changed. I do it because I have a certified sports physician thing that is required for that. So that's why I do it. But you do this online course first. And so you're doing your skills and you're doing your online class, which you can't skip through it. And I think that took me 2 hours and you can't go ahead. And then you have to go and have your skills tested. So like drive time, get there. There's a little, I think it was like an hour. I would say closer to like 4. I mean, it's very reasonable, but 4 hours every 2 years is,
Yeah, that's.
but I would say it's closer to 4 because like you can't go faster through that online class at all. You have to sit and wait for each one to go through.
Fair enough. Yeah, I'm okay with all that.
Does anyone have a motion? Well, I'll motion that we and Kristen, if you can give me some direction on this, then what do we just say that that we make a motion on the proposed language that you've put forth in attachment 5?
If I was to suggest a motion, it would be for the committee to approve the proposal as discussed to mandate the maintenance of a basic life support provider or advisor level certification for all licensees as a condition of licensure and active status. Directs staff to finalize the regulatory text for the proposal and present it to the board for consideration at the next meeting.
Okay, so can I just co-opt what you said and say I motion what Ms. Walker just said?
You could say so moved.
So moved.
So moved.
And I'll second.
Sabina, can I interrupt real quick?
Yeah.
Yes.
The only thing I would change about that motion is that it's a recommendation to the board, not that you are approving this language or anything for a regulatory proposal. It's just that it's a recommendation to the board. Everything else is totally cool.
Okay, so combine what Kristen said and what Sabina said, and so moved.
Thank you.
Thank you.
Thank you, Sabina.
Is there a second?
Second.
Thank you, Dr. Daniels. Moderator, would you please open us for public comment on the motion and the discussion relative to agenda item number 5, as we have so been doing?
Absolutely. We are now taking public comment on agenda item 5 and the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. For our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. We're going to take a few seconds now to see if we have a request. for public comment? Seeing no request for public comment, do you wish to continue with the motion?
Yes, thank you very much. Dr. Daniels, will you call the roll on the motion before us?
Dr. Lawrence Adams,
Yes.
Dr. Pamela Daniels, yes. Mr. Raphael Sweet,
Yes.
motion passes.
Thank you. All right, we'll move now to agenda item 6. And I think we're turning the time over to Miss Tammy Pitto to present this agenda item. Miss Pitto.
Yes, thank you. Good afternoon, everyone. So I'll start with just a little background on this. In early 2022, the board discussed pursuing a regulatory proposal to provide authority to waive the CE requirements when licensees have been affected by a natural disaster or a state of emergency. And at that time, staff drafted language to establish a regulation that would grant hardship exemptions to licensees on a case-by-case basis after receiving appropriate substantiation of the hardship to show that they had been adversely affected within the last year by a natural disaster or by a state or federal declared emergency as defined in the government code. The required substantiation would include the licensee's name, address, phone number, and email if applicable, a request for a full or partial exemption from the board CE requirements, and a statement that their address is associated with the area where and when a state of emergency or natural disaster had been determined. An explanation of how the state of emergency or natural disaster had caused a hardship that prevents that licensee from completing the CE requirements, and details as to why the request for exemption should be approved. Documentation supporting and confirming the licensee's statement of hardship, such as proof of residency in the effective area, financial records, or written certification from a primary health care provider. The board or its designee may approve or deny that request within 14 days of receipt and provide written notification to the licensee of approval or denial. If the board was to deny, they would have to notify and state the reason for that decision. Additionally, the licensee may submit a written request for reconsideration of a denial within 15 days of that denial. And then the request would need to provide reasons the licensee warrants a reconsideration, and the board would submit a decision in writing within 30 days of receipt of that request for reconsideration. Following discussion, the board voted to refer the issue to the committee for further development. However, the proposal was placed on hold while the committee developed the comprehensive updates to the annual CE requirements, competency areas, and course approval processes. Then during the December 1st, 2023 committee meeting, staff shared the following recommendations for this proposal. The first one is to add additional hardships such as a temporary or permanent medical condition or involving the licensee or their immediate family member to the list of qualifying events for an exemption or extension from the annual CE and basic life support certification requirements. The second would be to create a process for granting a reasonable extension of time to complete the CE requirements, such as up to 180 days, rather than a full exemption to address the majority of the hardships experienced by licensees, and retroactively apply the applicable courses to the appropriate renewal period using the Connect system to prevent the potential for double dipping of CE over multiple renewal cycles. And the last one is create a process for granting an exception or reasonable modification for licensees with a permanent medical condition or disability, rather than requiring them to annually file for the exemption or modification. So the committee did review the recommendations and concurred with developing a process to grant a reasonable exemption and to comply with the C requirements rather than an exemption for qualifying circumstances. So at this meeting, we're asking that the committee continue to the policy discussion regarding the development of this regulatory proposal and provide direction to staff on the draft language that you were provided. So with that, I will turn it back over to you guys for discussion.
Thank you. It sounded like you did that without coming up for air very
Sorry.
much.
Sorry.
That was great. No, that was great. Comments, suggestions from the committee, opinions, feelings?
Well, my question was, I just wanted to know more how we would handle the temporary or permanent medical and the exemption, and do we have the ability for the exemption in this category, which we didn't in the last one as far as the BLS. So I kind of have like more questions about it. And then also, is 180 days enough? You know, what made me ask that, and I don't have an answer, I don't know, I'm just asking, was that I live in California on the coast. And so we got a tsunami warning that said evacuate now. Like, so, and you know, my house is a little bit on a hill, but if a tsunami did come, I never would be getting to my house again. Even if my house was there, you know, it would take however long for them, because the road to get there would be gone, right? So it just made me think, oh wow, like how long would this take me? You know, what would my life look like? What does that look like? So I don't know, is 180 days enough? What does that look like for people who go through something like that? I don't know. So it just, I have more questions about it. I don't know how it would work. Can we do the exemption? And then how do we handle the temporary or permanent medical condition? So I don't know if Tammy or Kristen, you have comments on those questions.
So I'd start with the 180 days, and kind of the rationale behind that is gives you another half of a renewal cycle to bring yourself into compliance with the regulations. The thing is with natural disasters or other types of life events that, you know, that really impact a licensee and their decisions on moving forward, there's that thought of, you know, if you lose everything, you're also now impacted in practice. And what types of decisions are you making as far as, are you continuing to practice, or are you temporarily going inactive for a set period of time? Like, there's the reason or the rationale behind the 6 months was this idea that if you're affected in some way, that you're going to continue to practice, you're going to get an additional 6 months to get yourself up to speed. And this is cognizant of the fact that under this system, it's not the existing CE requirements, because we'll have the new ones in effect before this regulation would make its way through. So you have access to live courses via the internet. So it's a lot easier to comply than it would be, say, today, if you lost everything. And then on top, we're tasked with having to figure out how to travel to get to certain events. So that was the thought and the rationale behind the 6 months. We could certainly adjust it or entertain a discussion of changing that number, but it was around that, you know, if you can't comply after half of another renewal cycle, quite frankly, maybe you need to consider an inactive status or something else to kind of to get you along, because we have mandated CE as a required for each renewal cycle. If you don't take it, then you're subject to enforcement action. This extension process gives you another 6 months, helps you avoid any type of citation and fine for not doing your CE, and it allows you to keep renewing and practicing. So that was the rationale behind that. When it comes to medical exemptions, so under our current regulation, the CE committee or the CE staff deals with a workload around people that need a medical exemption from in-person CE, because whether they have some sort of medical condition or they're unable to travel, they'll provide a doctor's note, and they are basically exempt from the in-person portion of CE, and they can do everything through distance learning. With us, again, being mindful of the fact that this regulation is behind the upcoming changes to CE, we would now be accepting live synchronous courses similar to a platform like what we're doing here today. If we have licensees that can't participate in that type of environment, then it starts going into the realm of like, well, are they even competent to practice or maintain licensure and active status if they can't minimally comply with the CE requirements. So that's why we moved away from any type of extension to C or exemption to CE and moved to an extension model where it's like there might be a certain circumstance that's going on today that you need additional time. We'll give you some flexibility, and in return, you have to submit that documentation to us to demonstrate that you've complied with it. But if you can't comply at all and need an exemption, you're more than likely actually potentially unable to practice. But we could always have a further policy discussion around that. But that was the rationale behind it, was really moving away from exemptions and into extensions. And then the 6 months was based on half a renewal cycle.
Thank you. And do other boards have like timeframes? Do they have extensions?
Some boards do. Most boards, they'll have exemptions for medical type waivers. We had looked at something similar that the physical therapy board does around exemptions, and it kind of gives you a free pass for a certain amount of time. The committee had that discussion, I think, at the last meeting, and that's where we were leaning more towards an extension model, just so that you weren't able to skip the coursework. And then we had, in this concept, the other discussion point from the last one was removing like the discretionary questions around like, well, what would qualify and what would be approved, and just any vagueness there, which is a good move in the right direction, because OAL isn't going to let us just kind of have something that's discretionary on whether it's approved or not. So we try to add in a little bit more on the way of, basically, if you meet the qualification requirement, you will be granted an extension, and in turn, you're then going to provide that paperwork back to us. So there's other boards that have models, but I don't know that they would quite meet some of the requirements of OAL today, because they've got older language that they've had on the books for a longer period of time.
Okay, and then you remind me of something on the under C number 5. It says a statement signed and dated by the licensee under penalty of perjury. Are we wanting a notarized? Is this an affidavit? Is there a form? What's the detail on that?
That's the similar standard that we're seeing being used by other programs, and that we're planning to implement for our upcoming regulations, as far as drawing the line that we've got to hold them accountable, that, you know, if you're writing a note, that you're going to certify that this is true. We're not going as far as to have them, need to get it notarized. That's an additional cost. It's just simply a sign, something for them to sign. We would likely, this is a concept at this point, so we would expand it a little bit further to where we could be more specific. Like maybe we provide them with a form, so they don't need to make up something and start writing the perjury statement, but instead, they sign a form where they, basically certify and they attach their documentation.
Yeah, I just think standardizing some of those things would be better, because if you have different staff and different people looking at it, it's like, well, is this the signed statement? I don't know. So I think refining that a little bit. And then you said something that made me think about, so I have 2 other diplomates that I need hours for, 1:30, 1:25, 1:15. And I actually could not, my schedule wouldn't allow me to do a live class. And so I can audit it by doing an on-demand, so asynchronous, by keeping my time and writing an essay and writing my notes per the class. And so I can use that to audit, because I actually in 4 months cannot make any of the live ones that meet the requirements for these diplomates. So I just want to throw it out there as far as, asynchronous is not, I think asynchronous could be accepted and done if you have those guide rails, and it's being done by Dr. Adams, by our neurology board allows that you can actually audit. And so, I'm doing the class on my own time. I'm marking the time that I'm doing it, and I'm writing my notes, and then I'm going to summarize and submit it. So I think you can do asynchronous well. And I think we need to consider that, because, even though there's classes, I literally can't make any of them live. So I just wanted to throw that out there as a consideration.
I completely concur. I mean, I think that, that I mean, the delays that we've had with getting this comprehensive package through have been frustrating. I mean, for me as well as for a lot of other people. But the fact that we have such great programs out there that, asynchronous learning with phenomenal instructors that you can, do an hour here, an hour there, take great notes, go back and review it. I mean, it's just phenomenal. And I think it's really where we really should be going. I mean, I love live too, but I also know that, people's schedules are such that it's not always the easiest for them to get to a live seminar. And sometimes with technology, and the way that Wi-Fi can be a little bit, tricky. Sometimes those live events can be affected. But getting back to this particular issue, I think the way it's written, I like the idea of a um, uh, what are we calling it? I'm losing the word here. Extension, excuse me, rather than an exemption, extension for those. I mean, I think these are very rare. I think it's fair to say that this is probably a very small percentage. Is that fair to say, Ms. Walker? Is it
That's the
fair to say
intent.
that, I mean,
That's the intent there.
this isn't like a big issue all the time, right?
It's not currently, no. The CE unit does receive a handful of requests for under the current medical exemption. What we're trying to do here is kind of balance something that's reasonable and provides licensees with, just the additional time that they may need without opening the floodgates for an unmanageable workload. So we're trying to balance both of those here. And that's what I think that's what we're trying to balance here. And that was the intention behind when you look at language about, we want that request to be made ahead of time. So before you file the renewal, because we don't want to open the floodgates for suddenly everybody's renewed and then you get the audit notice in the mail and it's like, oh, well, I had this hardship. And it's like, yeah, but you certified on that renewal form that you did do the CE. So that was the intention behind it, was they've got to be out in front of it. This is the problem. Here's how you would get your extension and we're going to track it, but not create something that's just completely unmanageable for staff. So we're anticipating hopefully a low volume here, but giving licensees a little bit more flexibility, because we do get a handful of calls every month from licensees that, they wait till the last minute, something came up and they can't comply with their CE. And it's like, what do I do? Right now, we don't have a solution for them. It's like you either, you're either making a false statement on your renewal and you're potentially going to have an enforcement problem, or your renewing is inactive and you can't work until you complete your CE and reactivate your license. So this is supposed to help solve that problem for them.
Yeah. Well, I think, I mean, I like this approach better. And I think 180 days is reasonable for someone to certainly communicate what their situation is. I mean, if they're getting out ahead of it or they know something's coming up. I mean, obviously there's those situations where you get a notification of a tsunami coming, and that's always going to be an unusual situation if that were to have actually happened. But the threat of it obviously was real at the time. I just think that this is a great way to approach it, rather than exemptions, doing extensions, and then allowing the staff, or the board to hear if there's that one or two that are like really needing some attention, that then we can say, well, maybe you need to consider, like as you indicated, going on inactive status as opposed to, just extending time. So I like the way the wording is, and I certainly would entertain a motion. And if Mr. Sweet, if you have any other comments, I'll turn the time to you.
No, I don't. I think all my questions have been addressed. I was kind of wondering if this was something that came out of COVID, or how widely used this was, but I think we talked about that a little bit. So, but I agree, if there's distance learning that we can do now, then 180 days seems like a reasonable amount of time. So I'm good with things, and I like Dr. Daniel's points about honing some of those things in a little bit.
Okay, well then, with that, if there's no more discussion, I think this is kind of the same thing as the last agenda item, that we kind of want to make a recommendation. Is that what we're looking for? A recommendation for the staff to kind of dial some of this language in. I like the language. I'm leaning more towards. I mean, quite frankly, I think the 180 day and the way it's written is good as it is. And so my recommendation would be for us to instruct the staff to continue on this and then present it at the next CE meeting for us to vote on when the language is a little bit more succinct or dialed in, as we say. Anybody want to motion that?
This is Sabina, if I can interrupt.
Yep.
Sorry, can you hear me?
Yes.
Great. If we're just going to have staff take notes from this discussion and rework the language and bring back to the next meeting, we don't necessarily need a motion for that. At the next meeting, if you would like to move it forward through the board, we can have a recommendation at that time.
Is that what you're looking for, Ms. Walker? Is just basically the fact that we say this is on the right track and let's dial it in and then get the language more complete and then vote on it then?
I think it makes sense for this one. This proposal is not as fleshed out as the BLS one that we just discussed. So one more stab at it through the committee makes sense, I think. What I was hearing through the discussion is generally support for the concept that's in the meeting materials, but then the addition of the point that Dr. Daniels made around providing some sort of flexibility within that extension period to potentially be able to allow the person to complete asynchronous learning. So then thereby kind of creating an exemption to those live CE requirements that we have, because that gives the two-prong approach of flexibility. So you get an extension, but then potentially if there's the need there, you also could potentially complete all your hours through distance learning. So we can definitely craft something that includes both of those components and bring it back for the committee one last time before it goes to the board.
And I think also, as you pointed out, the likelihood that when this does go through, our component of video conferencing will have been approved by that time. Isn't that kind of the thought?
That's correct. And those are the assumptions in this proposal, because we wouldn't have crafted it the way we did if we were still entertaining this idea that people would have to attend. I mean, they're still more than welcome to. Those will still continue to exist, but there's not going to be, when these proposals that we're working on today, when these go through, there will be no mandate for live in-person courses. But I see Dr. Daniels' point to where still trying to get something scheduled, just depending on what's going on, and having to be somewhere at a specific time can still be a hardship for the licensee. So potentially still having language there to allow for asynchronous, we can build that in.
I think I mean, that seems like that would be a small, easy fix to the language that's there. So excellent suggestion.
And I also liked, I don't know if it needs to be language in there, but I like Dr. Daniels' thought about having some forms surrounding the statement signed by the licensee as well. I think that would help things a lot. I don't know if it needs to be in the verbiage itself, but if we could include something in that as part of the process of getting this through, I think that'd be great.
And then
Mr. Sweet, you're referencing the penalty of perjury aspect of that, right? That
well,
they're,
not just the penalty, but just just as Dr. Daniels was pointing out, that someone could just provide like a one-sentence piece of paper just saying this is the issue, and rather it's better to have, I think, a form where we're kind of explaining exactly what we need from them as well.
Yeah, I agree.
Yeah, I was just going to add on to that. Just Ms. Walker, anything that can be standardized as far as what they're filling out, like the application or whatever, just so there's no delay. If there's staff changes, everyone understands what's needed, it's provided, so within that, if you can add any of that, I think it would just be more standardized.
Well, when you look at items A, B, C, D, 2, 3, or basically A, B, C, D, that kind of creates its own form, which I think would be easily standardized. Don't you think?
That's correct. That's the intention there, and we can build it out just a little bit further with even more detail. We've been going down the path of, with regulations, not incorporating forms by reference, but being very specific in the regulation of what the form requires. So we can definitely, we'll take this and build on it a little bit further so that we can have a form rather than more a broad request.
Yeah, I agree. All good comments. Thank you. Okay, well then, since we don't need to make a formal motion, I just would encourage you, Kristen, and the staff to take our comments, suggestions, and I think you are well down the road of of coming up with some great more future good policy for our profession and for the board. So with that, we'll open it now to I just don't want to cut anybody off. Was there any last comments, Dr. Daniels or Mr. Sweet?
No.
Nothing
Okay.
for me.
Thank you. So moderator David, would you please open it up for public comment for agenda item 6?
We are open for public comment on agenda item 6 and the discussion you just heard. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. For our mobile device users, you may need to hit the ellipses button, that's the ... in order to find that hand. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, thank you. Appreciate that. Agenda item 7, future agenda items. So we will open this up to the committee. Are there any future agenda items that would like to be added? I see Dr. Daniels' hand is up.
Yeah, I wanted to add what we discussed, discussing a pathway for migration to the Connect system, on how to kind of move that along. And then also what we were just talking about, if appropriate, expanding on kind of the on-demand issue, because, just to reiterate what Dr. Adams was saying, there's a lot of good classes by great teachers that are on demand, and some people learn better when they do it at their own pace or at their own timing of, they're better morning people or evening people. Or so anyways, I'd like to just kind of further investigate that, especially with the issue that we were talking about. That's all I have.
Mr. Sweet?
Nothing from me. Thank you.
So I'm not wanting to open a can of worms, and we're doing great, but I will, an agenda item that was prompted by the public comment email relative to the discussion about the fact that the board never discussed the interpretation of the synchronous, asynchronous, or video conferencing, that was a decision made by a staff that was in charge of the CE back at that time. And I would think that, one of the sticking points for providers right now is this lack of clarity on the ability to utilize video conferencing for live. And the holdup is, people are still having to go to actual locations as opposed to being able to use video conferencing because we're still waiting for this comprehensive package to go through. So perhaps on a future agenda item, we can revisit the fact that that a committee, nor did the board ever make their own determination as to that particular rule and whether that was interpreted correctly. I think that everybody on the board agrees that video conferencing is a good form of learning and has been beneficial, and that became very evident during COVID. And if it's something that can be handled by the board saying, well, we interpret it this way, not that it was a staff interpreting it, if that ends up being true, that was something that the board never discussed back at the time, then I think that's something that a committee and then the full board should be discussing, because I think that might, as we're waiting for this comprehensive package to go through, might give a little of relief and clarity to providers that we as a board feel like the video conferencing is a viable, and that our interpretations and that would basically allow that to become available immediately rather than keep waiting for this package to go through, which is just going to ratify it. So anyway, that's something I'd like to see on the agenda, to have that discussion, and maybe the staff can look back through or come up with some of their opinions or ideas about why that was interpreted that way, as opposed to the way that it is, way that it could be or should be now that we feel better about video conferencing. That's my 2 cents. Sound good? Okay. Moderator, is there any other items or future agenda items?
We are open to public comment on future agenda items. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. For our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request, would you like to continue with the agenda?
Yes. Okay, we're at adjournment time. Everybody feel ready to adjourn? We're ahead of schedule.
Just for Sabina, I'm going to make a motion to adjourn.
Second.
That motion, should we call it to roll or should we do it by acclamation?
Acclamation.
Okay. Sabina, is that okay with you?
She's gone. She's left the building.
Oh, she's already left the building. Okay.
I don't know.
That's how she feels about adjournment.
That's how she feels. She's already left the building. You were out the door?
I was, no, I'm kidding. I heard the word
It is
adjournment.
Friday. It is Friday. So, all right. Well, listen, thank you everybody for your time and great meeting. And we will stand adjourned at
Dr.
2:06.
Dr. Adams.
Yeah.
Future meetings.
Oh, I mean, like as far as the future meeting time?
Well, no, we need to schedule. Not
Oh,
now.
Was there,
I'm just-
was
I'm
there,
just-
was there some suggestions, or do we want to do it via doodle poll? Is there any suggestions?
I don't know if we can do it now. If we can't, then I just want to get it out there that we need to.
Yeah, I agree. I think that I think Ms. Walker, have we gotten the new date for our January meeting that's been pushed?
No, not yet. None of the January dates were viable. We can't get a quorum, so I'm going to get an email going today, this afternoon, on some dates in February. And then I can also start an email thread so we can start getting our CE committee meeting dates on the calendar. Dr. Adams, if I can get availability for you, I'll send you some possible dates, but if I can get your availability as chair, and then I'll forward it to Dr. Daniels and Mr. Sweet so we can get those on the agenda, on the calendar.
Specifically, you mean specifically for CE or for the general board meeting?
For the CE committee meetings. So I'll send you some time windows, and then we can get that going.
Okay, well, I'm thinking since we probably are going to be pushing it to March, and it looks like we're having difficulty in January, we probably, in February, we're looking to try to do the board meeting, general board meeting in February. We probably would be looking sometime in March. Is that accurate?
That's correct, yeah.
For the next CE meeting?
Yes.
Okay. So is everybody, Kristen's going to get like a doodle pool together for the month of March. How does that sound for everybody?
That's fine. I can do it now, or I can do it by doodle, whatever.
We didn't agendize the discussion, so we'll get some emails going around with some availability, and then we'll get that for the board meeting as well. So ideally, I can help lay out quarterly meetings for all of 2025. So an email to come for all of you.
I'm with Dr. Daniels. I like to get stuff locked in. So if we can have a somewhat sense of urgency on getting that out, and dates in March, that way Mr. Sweet, Dr. Daniels, and myself can jump on that and get that locked in.
Yep, we will.
Awesome. All right. Well, fantastic. Everyone
you.
have a wonderful weekend and be safe out there.
Bye.
Thank you.
All right, thank you.
See you later.